Hello everyone, let's go and study indirecting cholinesterase drugs. Organophosphate intoxication and cholinesterase regenerators. In this last section, you have studied cholinesterase inhibitors, cholinesterase inhibitors. They are indirect acting cholinesterase agonists. Actually, their inhibition on cholinesterase is reversible, but this group of the drugs compounds, organophosphorus compounds, they are irreversible inhibitor for the cholinesterase. Actually, they are insecticides used for agriculture. In the agricultural production, they are so widely used, like melasine, pyrazine, dipteryx. It also caused by chlorophylls, DDVP, and Roger. Maybe some students know this. Mechanism of toxicity. Actually, these drugs, because they are irreversible acetylcholine inhibitors, they has to strong inhibition on this enzyme. So they usually, for us, they cannot work as a drug, just induce some toxic reactions. Once someone take organophosphates, these drugs enter the body and then bind to the cholinesterase. There is a covalent phosphorus enzyme bond, and this substance compared with the cholinesterase acetylcholine complex and neostigmine cholinesterase complex, it is extremely stable. So induce acetylcholine endogenous acetylcholine cumulative. This result, it is stronger than the neostigmine. So cause muscarinic signs and nicotinic signs because of M and N receptor overactivated by acetylcholine. And after covalent phosphorus enzyme bond formed, after a period, if this bond formed for relatively longer time, this enzyme become aging. Once enzyme become aging, it means no one drug can recover the activity of the enzyme. Before enzyme aging, some cholinesterase regenerators can recover the activity of cholinesterase. Now, this enzyme aging, it means the phosphorus enzyme bond is more stable than that of neostigmine enzyme bond. After the initial hydrolysis, one of the oxygen phosphorus bonds of the organophosphate may break, resulting in further strengthening of the phosphorus enzyme bond. This is aging of cholinesterase. After aging of cholinesterase reactivators are invalid. So once the organophosphorus intoxication once diagnosed, should use this drug in time. Once use this drug very late, it is invalid. Once some patients has this organophosphorus compounds intoxication, take these drugs, what are the symptoms? Now, let me introduce the signs of toxicity caused by organophosphorus compounds. These drugs can inhibit irreversibly cholinesterase induce the acetylcholine, endogenous acetylcholine neurotransmitter accumulative. This can activate, you heard that it means overactivate IM receptor and N receptor. So induce some effect mimic to the increased function of the parasympathetic nerve. Now look at first one. Muscarinic toxicity. These symptoms are caused by IM receptor overactivation. So we usually call this by IM signs. Now look at on the eyes, remember, because of direct activation of IM receptor in the iris sphincter and ciliary muscle, it can induce miosis, decrease intraocular pressure, and cyclospasm. But you know, if you are a doctor, you just can observe this at the beginning, miosis. So this is very useful symptoms. And gland secretion increase. This response is also usually determined by the different rules of administration of these organophosphorus compounds. Secretion of salivary, bronchial, and sweating glands, they increase, especially some patients maybe have some symptoms like sweating or salivation. It is helpful for diagnosis. And increase the gastrointestinal and genital urinary smooth muscle activity. The patients, especially after oral administration of organophosphorus compounds, the patients will show the symptoms like stomachache, nausea, vomiting, even diarrhea, even fecal incontinence, and urinary incontinence. Cardiovascular system has a negative effect on the heart, especially decreased heart rate and maybe also decreased blood pressure. Respiratory system, because of the smooth muscle in the IM receptor in smooth muscle and glands in respiratory system, induce bronchial contraction and bronchial gland secretion increase. So make a breathing difficulty. So maybe the patient has these symptoms, dyspnea. Actually, this maybe it is dangerous. So try to save the patient's life with some specific antidotes. N receptor induces nicotinic toxicity. We also caused by these enzymes. You know, N receptor include NN and NM receptor. So ganglionic stimulation shows the superiority effects. Usually above mentioned symptoms increase, but cardiovascular system, heart rate, especially blood pressure may increase. Neuromuscular junction, an IM receptor is overactivated by acetylcholine. Skeletal muscle interplate depolarization leading to fasciculation and paralysis because of muscular tension decreased. Do you know the word of fasciculation? Means muscular fibrillation. I think you understand the skeletal muscle. A piece of skeletal muscle usually it consists of many muscular fibers. I think you know this. And the different fibers in a piece of skeletal muscle usually they contract or dilate synchronously. Understand? Because one somatic motor neuron may innervate 100 muscle fibers. So this arrangement leads to the formation of a motor unit. So usually in a piece of skeletal muscle, different fibers work as a motor unit. Their function, contraction or relaxation, is synchronous. But when the NM receptor in these different fibers, muscular fibers, it are activated by acetylcholine, because of there are so high concentration of acetylcholine. This NM receptor overactivated by acetylcholine. So different muscular fibers cannot contract or dilate synchronously. Do you understand? They will work separately. So induce fasciculation, muscular fibrillation. So the total force of the skeletal muscle strength, it is decreased, induced muscular tension decrease. That is caused by paralysis. So this is the major response of enzymes. Actually, enzymes mainly means these symptoms. CNS. Acetylcholine, it also is one neurotransmitter in CNS. It also can increase. So they cause generalized convulsions, which may be followed by coma and respiratory arrest. CNS, including ganglia, once they are overactivated, overexcited, finally always convert into depression. So followed by coma or respiratory arrest. So it is dangerous. That is, maybe some people has some chronic toxicity. Just now I introduced these enzymes, and enzymes usually they are acute toxicity. Once some people has a chronic toxicity, usually the symptoms are not very classic. It is relatively difficult to diagnose. The patients usually has some symptoms like neurasthenia, always feel fatigue, and strength of the skeletal muscle is not enough, has some like headache, dizziness, this unclassic symptoms, even abdominal distension or sweating. But usually the activity of the cholinesterase is decreased. This is the major base for the diagnosis of chronic toxicity. Like for some people has a long period to touch or to touch the organophosphorus compounds, like the workers in the factory, or these people maybe have some chronic toxicity. Okay, I still have a question. If you are a doctor, there is a patient with acute insecticides poisoning, what will you do? So just now I introduced the enzymes and enzymes for diagnosis. So once diagnosed a patient with this poisoning, so what will you do? Let's go on. When you meet a patient with some organophosphate poisoning, what will you do? So first thing is to diagnose. Usually based on the history of touching the organophosphate compounds, and also mainly based on the signs of poisoning. And of course, the activity of the cholinesterase in the blood, it is the most important factor to diagnose. So based on this result, you can diagnose whether the patient has this organophosphate poisoning. And how to prevent and treat this organophosphate poisoning, it also is very important. For prevention of toxication, actually we should strictly execute the protective and regulatory regimen of pesticides, reinforce the protection of working and education of safety knowledge, and strictly control the sales of highly toxic pesticides to avoid suicidal case or food contamination. So for the farmers, especially those people, to educate this, try to avoid this unlucky things happen. How to treat the patient with organophosphate compounds poisoning? First, clearance of the poisons. If the patient is a farmer working in the field, try to remove the patients from the local area of the field, and then decontamination to prevent further absorption. Try to remove all clothing and wash the skin with soap if this patient is a farmer who was using these drugs. Try to prevent further absorption from the contaminated clothes and skin. If the patients took these organophosphate compounds orally, take a gastro lavage with 2% sodium bicarbonate solution or 1% sodium chloride solution. It is really helpful to wash stomach to prevent the further absorption from stomach. But except for dipteryx, because these are basic solutions. In the basic environment, dipteryx will convert into more toxic substance, DDVP. Yeah, so if the organophosphate compounds, it is dipteryx. So don't use this basic solution to wash. If the toxic substance is parathene, don't use potassium hypermanganate to wash. For the patients with poisoning, if it is oral administration, so purgation with sodium sulfate or catharsis with sodium sulfate, they are same meaning, to wash the intestine, so to prevent the organophosphate compounds further absorbed from intestine. It's also as necessary. And at the same time, more important matter is use specific antidotes. You are studying pharmacology. Now I'm trying to teach you the specific antidotes. For the organophosphate compounds toxication, you should use these two drugs, antimuscarinic drugs. Yearly, it is atropine. Use atropine in large doses, given as often as required to control signs of muscarinic exercise. Another drug is cholinesterase regenerator drugs, like palidoxine. The abbreviation is PAM, or PAM chloride, or obidoxine. Use these drugs. You should use them according to this principle. Usually, use them in combination, especially for the moderate or serious patient. For mild patients, usually just use atropine, it is enough. And use this drug, especially atropine, in full dose. in full dose. Understand the meaning? The dose should be used as large as you can. Of course, try to avoid the new intoxication caused by atropine, but the dose of atropine should be enough. Usually, we use some symptoms to judge whether it is enough. So that is caused by atropinization. What conditions we can call the patient has atropinization after using atropine? There are 5 Chinese words to help you to remember this. 大、干、红、快、湿. 大 means, bigger. Pupil means pupil size become larger than before. 干 means sweating and salivation, disappeared. Skin feel dry. The patients will feel dry on skin and feel dry in the mouth because of the secretion of glands is inhibited by atropine. Because atropine, it is M receptor antagonist. Remember, M signs all caused by M receptor overactivation. So there are so many symptoms related to M receptor. So M receptor blockers, atropine, can can correct these symptoms very soon. 红 means flush in the face or skin of the patients. 快 means heart rate increased because of atropine block M receptor. So the vagus nerve function is abolished by atropine because of M receptor blockade. 湿 means disappear in Chinese, disappear. It means the pulmonary moist rails disappeared because of the secretion glands in the respiratory system. It also is inhibited by atropine. When the patients show these symptoms, it means the dose of atropine is enough. And repeated use, try to maintain these symptoms. So we usually use atropine, not to only one dose, multiple dose is necessary, very important to maintain the effect to control M signs. And the early treatment, once diagnosed, should use the specific antidotes as early as you can to control the symptoms of organophosphate compounds. These principles are very useful. And another measure is purified blood. Actually, till now, because of the development of medical science, we have more developed measure to control these organophosphate compounds. Purify blood is really helpful if the condition of the hospital is good enough, and actually the cholinesterase regenerator at that conditions, it's not useful. Just depend on machine to purify blood, try to remove the toxic substance from the body directly, based on this purification. And of course, symptomatic treatment also is really helpful, like airway management. Maybe it is necessary to make artificial respiration, and like using diazepam to control convulsion, and even anti-shock. Some anti-shock drugs is helpful. Yeah. Okay, this is the treatment of acute intoxication. Just now I mentioned cholinesterase reactivator drugs. The first drug is pyrrolidoxime iodide. The abbreviation is PIME. Another agent is pyrrolidoxime chloride. The mechanism of intoxication. Organophosphate, because in the body it has a relatively higher affinity to cholinesterase, and then forms phosphate complex with cholinesterase. Then the activity of this enzyme is inhibited, so induce toxic effect. Enzymes and enzymes caused by overactivation of acetylcholine. The mechanism of detoxification of pyrrolitoxin, because this pyrrolitoxin has a higher affinity to bind with the organophosphate compounds. First of all, phosphoro-PAM complex, and at the same time, the enzyme cholinesterase recover its activity, so it is released, and it can metabolize the cumulative acetylcholine. At the same time, for some free organophosphate, which doesn't bind to the organophosphorus compounds, for that free organophosphate in the blood, this PIME also can bind to them, so form the non-toxic phosphoryl PIME. So promote this non-toxic substance eliminated with the urine. So this is the mechanism of detoxification of PIME. Actually, this cholinesterase regenerator has different therapeutic effect on the different symptoms and different toxicants. For enzymes, nicotinic toxicity, like fasciculation or paralysis of skeletal muscle, these symptoms can be corrected by this drug relatively faster. But CNS toxicity, the symptoms like overexcitation of the CNS, that symptoms just has a little effects, not very good enough. But for enzymes, usually this drug is invalid. That's why in the clinical practice, enzymes usually use atropine to correct. Atropine, cannot be substituted by this drug. It's really more important than cholinesterase regenerator. For the acute toxic pesticides, if the poison substance is malacine, like malacine or others acute toxic pesticides, the therapeutic effects of PIME is the most obvious. If the toxic substance is DDVP, the therapeutic effects also is relatively good. And the Dipterex is also effective. But if the organophosphate compounds is Roger, it is not useful. Usually, that therapeutic effect is undesired because Roger contains benzene. So when this poison is caused by Roger, it usually include benzene toxication, and Roger also is a kind of emulsion fluid, so it is more difficult to correct by this drug. Notice, we should use this drug in the range scope is like this. Therapeutic dose is from 0.5 gram to 3 gram. Try not to use this drug in too large dose. Just now I mentioned it is not effective for the intoxication of roller. So atropine should be simultaneously used. Actually, in these conditions, atropine is more important in the treatment of organophosphate compounds intoxication. Adverse effect. Just now I said yearly use this drug in therapeutic dose, not too much. Once in a relatively higher dose, excessive doses, it often induces debility, visual disorder, nausea, vomit, and tachycardia. These are symptoms. So try to avoid use this drug in relatively higher dose. Pralidoxime chloride. This drug is better than pine. Its pharmacological effect is similar to pine, but it is more stable in water solution. So it also can be administered intravenously and intramuscularly. But for pine, just used intravenously. And this drug, PAM chloride, has relatively fewer side effects than pine, so it is better one. Okay, that's all for this chapter. I also give you several questions to help you to review the content in this chapter. The following slides, they are summary of cholinomimetics, so you can study by yourself. Preview questions for next class. Okay, that's all.